The next item up at 5:50 p.m. is going to be the presentation by Rick Keneally. And get that right sooner or later, Rick, you know? And boy, I hope I say this correctly, Katrina Korfbacher? Hey! I was going to say Baker, professor of environmental medicine at the University of Rochester Medical Center on the importance of sampling wastewater and the value of increased sampling. So I'm going to hand it to Todd.
Thank you, and good evening, and the introductions have already been done, so you know who I am. And I think I spoke at the end of one of the workshops or board meetings in regards to our facility being accepted into the New York State wastewater surveillance system or network. And Syracuse University picked up the cost of the sampling for us to do this once a week. It kind of brought me into this. I was then introduced to the Monroe County wastewater working group, surveillance working group. That's where I met Katrina. She kind of is the MC of the bi-weekly call, and they've been doing this a lot longer than I have. I jumped in. We've been sampling for a month now, once a week, but as we know, to get a clearer picture, we're looking at doing sampling 2 or 3 times a week to kind of get a little clearer picture of what's going on in the community with COVID. So to do that and to dig deeper into this, I invited Katrina to join me to kind of give you a better overview of what's going on, proverbial expert in the field, and looking for actually the support of the board to garner that additional funding to cover the other 2 samples over this next 7-month period. And with that in mind, I'll turn it over to Katrina.
Well, thank you so much for having me, and now I feel like I do need to explain, even though you said I don't. I work at the University of Rochester Medical School, and I'm at work, and this is our practice at my work site. I also teach there. I teach environmental health policy and a couple other classes. And when the pandemic started, I'm not a doctor, so I couldn't see patients directly. I'm not at the public health department, but I realized that I had the ability to try to do something to help with counter the pandemic, and it was this, trying to figure out how we could use wastewater to inform decisions to protect people in the most efficient and effective way possible. So if you were thinking about the choice of whether to pay for this or not, I figured you'd probably want to know why and what it is. And I've learned a lot about it. I'm not an expert, but I certainly have been following what other communities are doing, and I'm just really delighted to share it with you and your interest. So I thought I would just very briefly explain to you what wastewater surveillance is, how I think it can help Webster, sort of how it fits into where you are right now, and then also the future potential, because hopefully we are at the tail end of this one, but there's a lot of excitement about what this could do for us in the future, because in this pandemic, and this is a little graphic from a New York Times article back in the fall of 2020, the failure to control the pandemic has in many ways been a failure of real-time health data. That it's been very difficult for us to really, next slide please, understand what's going on. So I wanted to start by explaining that wastewater surveillance, we've seen it in the news recently, but it is a very well-established practice. Back in the 70s, Nancy Kahn, who was one of the first female microbiologists in Edinburgh, found the source of and eliminated a typhoid epidemic in her city by doing this. Next slide, please. And is most famous for helping to stop polio. So the efforts to end polio are really attributed to being able to track the virus in wastewater, monitor its long-term elimination. Next slide, please. So when COVID came along, not surprisingly, people who do this stuff said, well, I wonder if it'll work for coronavirus. So are we able to see this virus in wastewater? Turns out, yes, you could. Very smart people in the Netherlands were some leaders there. Next slide, please. And the logic is this. When we're trying to figure out which direction is the pandemic heading, who's getting sick where, what's going to happen next, we're used to testing people, but you don't get people tested unless they're feeling sick for the most part. And that comes many days after they've been infected and have been infecting other people. Or you can track hospitalizations, right? We've seen all of that data. That usually is a couple weeks after someone has gotten sick. They get sick enough to go to the hospital, and then deaths even after that. So the question is whether wastewater could let us find out sooner what the direction of the pandemic is. Go ahead. And it turns out it can. And very reliably, they found an early warning, especially when population testing is super high level, of 5 to 7 days. So the red line is the trend in the wastewater, and the black line is the line in the sewage, and you can see they track pretty solidly. So once that discovery was made, poof, science happened. There have been many, many articles written. Labs all over the country, all over the world, have been working on methods to make sure they can do this reliably, to figure out, how many people in a town of this size would need to be sick to be able to be detected in the wastewater. And it's been quite well established. If you go to the next slide, this is one of my favorite things to check. It's the Deer Island wastewater treatment plant in Boston. And if you know anybody who lives there, you'll know that their pandemic numbers have surged a little bit before ours. So on January 14th, when I saw that high spike had plummeted down, all of a sudden I had hope that we were going to soon thereafter see our cases come down as well, because they have been so reliably tracking, and it's been so robust in predicting what happens in the population. So it's impossible to talk about this subject without making a couple puns. This is Scoop on Poop. That's one of my favorite children's books. So when people are, when we are relying on testing people, the nose swabs, that is limited by who chooses to go test and when. The availability test, the cost of the test, the inconvenience, the annoyance. But everyone contributes a biological sample to the sewer system, to Rick's folks every day. And infected people may start showing in that sample 5 to 7 days before they ever get sick and go to get tested. It's important to know the virus itself doesn't survive very long in the wastewater, but the little bits of RNA remain and can be detected long afterwards. So we can monitor wastewater as it's coming out of this building, as it's coming out of a community like a campus, or out of a whole town at the wastewater treatment plant. And the amount of the genetic material of that virus that we see in a sample reflects the number of people in that sewage set who are sick at that point of time. And the results can therefore inform people in making decisions like the conversation that you just had. So people are often curious, how does this actually work? It sounds really icky, but it's really quite a sanitary process. And I know Rick has got several of these composite samplers. They're just lowered into or attached to a line. And then the sample like that is taken out of it, sent off to a lab where it's spun around in a centrifuge to condense the viral DNA at the bottom, and then it's run through a PCR, and they can tell how many copies of the RNA representing that sample there were. So, and that sample can initially be taken, it's been taken at universities, at industries, work sites, nursing homes, prisons, wastewater treatment plants like you're talking about today, and across the state, and I think now 40 counties are participating, or 40 sites, 26 counties. So we have a dashboard that's live, and you can check anytime about what the trends are in different places in New York, and there's also a national wastewater surveillance system that's being built. So just to give you a sense of what's been happening here in Monroe County, that is our big wastewater treatment plant in Durant Park, the Frank E. Van Laer wastewater treatment plant, aerial view. And this map shows its sewer shed, where the waste comes from that ends up at that treatment plant. And I wanted to show you this, the different colors, because you can see that it's broken down into different sections, like a watershed might be. And your sewer shed is the same. That there is the opportunity to take samples at different places, so you can see if, is it over by where we have our university that the levels are higher, or are they more downtown, or are they up to the east? You could do that, but so far we've just been testing the influence samples to that plant. And just so you know, that particular plant, as you may know, also gets stormwater into it, so there is wastewater coming out of houses and buildings and work sites. But there is also stormwater that gets mixed up with that on the way to the wastewater treatment plant. So when that is mixed up, they both are ending up at the wastewater treatment plant, which means that it's a little tricky to detect the virus there. But nonetheless, it has still done a really good job of tracking with cases in our county over the last couple of years. Next one. You probably saw it in the news, in the article that Rick provided you, several colleges in our area have been doing this because they saw what a challenge it was going to be to maintain a safe environment early in the pandemic, especially when they didn't have testing capacity. So we learned together about where they can sample, how they can sample, and what it means for their campus environment. So St. John Fisher has these little boxes. You may have seen them on their campus sitting next to 6 manholes that basically represent each of them a major dorm. one of them goes hot, they know to test the kids in that dorm. When they all went hot, that's when they decided to close the campus down. RIT has a system that is less visible because they drop that composite sample down into a manhole and they pull it out, which is when you're doing it at 5:30 in the morning on an icy day, not such a fun job, but less disruptive to the aesthetic environment. So these colleges have found over this period of time that in addition to the student testing, and especially when testing rates have varied, this has been an additional source of data that has been very helpful to them in making all kinds of decisions about how they communicate about and how they protect public health on campus. Next slide, please. I also just wanted to give you a really quick example that Corning Industries was so excited about this that they paid all 7 wastewater treatment plants in their area where their employees live to do sampling there. And they have taken that data and used it to decide their protections for their workers. They've been doing this since fall 2020, quite quietly, but just using that information, go ahead if you like, so they don't have to be testing the employees as frequently, to get an earlier warning. And they have found that quite consistently, this information has given them a 5-day lead time before people start showing up really sick to work. So it's been very helpful to them in protecting their workforce and keeping their plants open. Next one, please. Okay, so this is where we are now. As I mentioned, New York State has built a wastewater surveillance network. Hopefully you will all go and click on this website afterwards and you can look up your own data. It says that your rates have gone down 3%, I think, in the last 2 weeks. Now, that's just one sample per week, and what we found is that this is really bumpy data. It is much more nuanced, it is much more effective, it is much more useful if you have it 2 or 3 times a week. The universities have found that absolutely as well, because you need 2 or 3 samples to get a trend, to figure out which direction it's going. So we're really lucky that the state has been paying for one plant in each county, and because we pushed really hard to get our other 2 plants into the CDC's national system, that meant that Webster is benefiting from that funding from the state. And you know, your data is up there on the dashboard, and nobody else's in Monroe County is because the CDC doesn't have its act together quite as quickly. I think that's all I wanted to say on that. Real quickly, if I'm thinking about, you know, if I were sitting in your shoes and saying, okay, the pandemic's going away, why still do this? Testing is much lower now, and people are testing at home. So the case data that we're getting from the county is county-wide, and it is a lot less reliable. So looking forward, being able to get Webster-specific data and confirm that ongoing decline, I think, could be helpful. It's also, you had talked about, you know, people making their own decisions. The original vision of this was to have a dashboard. Like if you go to the beach in the summer and you check to see if the water quality is good or bad that day before you decide to go in. You can check the wastewater and see how safe is it out there. Is this a time that I'm choosing to wear a mask or not? Is this when I'm going to go visit my grandparent in a nursing home or not? So it can inform individuals' daily decisions, nursing homes, residential facilities, businesses, as they decide about how to conduct their business. Also could provide early warning of new surges. If nobody is out there getting tested, how are you going to know if the virus is back in the community? This lets you know. And especially providing a baseline for longer term monitoring as we come into next year. I also wanted to mention that there is some other possibilities. Rick mentioned he's got a couple portable samplers, so if there were areas of concern where, you know, maybe there were a lot of older people or a school shed where there were particular concerns, you could take those samplers and identify, you know, where there are hot spots or not, you know, where is a place that seems to be quite free of the virus at any given time. It also, just on a really geeky wonky note, they found the new strains of the virus in wastewater first. In fact, they found in California and Oregon and Massachusetts before they found Omicron in people. They found it in the wastewater. Can monitor the effectiveness of policies about like whether vaccines are being effective or not, and whether things like masking or social distancing are helping. And also, there is ongoing work for detecting influenza, future viruses we don't know about, can also be used for things like opioids or cannabis. There's several communities that are very excited about using it for those things. But I think about particularly influenza. You know, we know that we had 16,000 people a year dying of flu before this pandemic. If we were able to monitor at nursing homes and in communities to see when that virus is coming up in future years, you know, that has a huge potential as well, even if we never have another coronavirus. Anyway, so those are some of the things I wanted to share with you about this that I hope inform your decision. That's all I have, but I would love to take any questions you have.
Katrina, I want to thank you for presenting. We've known each other for 10 years, and I've known you as an expert in the environmental health field, as well as an advocate, and I really appreciate your work on all of this.
Thank you.
I chuckled when you said the CDC because I had been doing some reading and realized that the CDC is way behind on their reporting. I did find the dashboard for Montgomery County, so I was looking at that.
One of those, things where sometimes starting at the local level is more effective.
It still gets reported to CDC, correct?
That was amazing, by the way, Katrina.
Thank you.
You're good at your craft. Rick had kind of explained this to me, not in that kind of detail. But
No, that's why she's here.
I found it fascinating that, for better or for worse, the town of Webster has its own sewage treatment plant. And if we're going to have it, I'd like to see the town take full advantage of that. And what amazed me is that the one slide, a couple of the slides really resonated with me. The one where you said, here are the things that we track, and they're all kind of after the fact. They lag by days, weeks, whatever. This gives you the opportunity to have real-time or predictive, which is amazing. It makes my mind soar thinking of how you can utilize that for good, bad, whatever. I know at the beginning you had said, Rick, that part of the reason we're doing this presentation, maybe the biggest one, is that will the board approve funding for the next 7 months of this? And off the top of my head, I don't know what that entails as far as if it's $10 or $10 million for this. Okay, well, that's good. And from a standpoint of, would the testing for the next 7 months be specific to COVID-related variants, or is this something where you could pick up based on testing 150 different things? You could find out, like you said, if from a certain area there's opiate use there, or there's something else coming up in the community.
The lab will test your sample for whatever you pay them to. So I think the cost estimates that Rick have developed is, we've been working this system up for coronavirus. We have the potential for using it in other things in the future. But for example, the Deputy Health Director of Genesee and Orleans counties is very concerned about opioid use in those rural counties. And they just did a pilot over 8 weeks with a different lab. And they said they've gotten some very, very interesting findings, and they're going to think about building that into their systems in the future. But for now, we're really focused on coronavirus and making sure, seeing how your numbers reflect your community.
And you said we're on the dashboard now.
Yeah, that was a real screenshot that I took last night.
Yeah, that screenshot, so the brown, is that just a misnomer that those areas are going up by 75%?
The brown just means that those areas aren't testing.
Aren't testing,
So
okay,
they
because I
just
looked at the key and it said up in the right-hand corner, like...
Oh, that's a dark red.
Okay.
Yeah, the brown just means we have no data.
I got you, okay, well,
Sorry about that.
that's okay. So we're testing now, is that because we were chosen, Rick, or?
Yes.
But that'll end and now we haven't been paying for that?
We have not been paid for it. It's been funded by the state.
How long will it be funded?
7 months
So we're
of
looking,
1 sample per week.
so we're looking at doing additional samples to get a better,
Yes.
a better
And I think the
baseline.
vision is to really ramp up, and you can actually start backing off. Once you get a pretty much a baseline of what's going on, you can back off to the 1 or 2 times a week, and then all of a sudden, if you see something, then you ramp sampling back up. So
What's an example of seeing something?
I'm still learning all this. I actually got a tutorial on what my results are telling me, and it's a little Greek still.
So
If you want to
you know
back
what
up to
Boston-
the slide from Boston, that could give you an example of that. So they had, if we go back to one of the
Deer
first,
Island?
well, that's one from, the fall of 2020, where we saw that there was an increase for that winter surge there. But if you go all the way back to the Deer Island plant, this is one of their calculations for part of when they close schools or not, they had just a formula in Boston, in Massachusetts, by their state health department. What percentage of kids were testing, the population was testing positive, and what direction the wastewater was heading, and they said, you know, they just had a little algorithm of what combination of those things would make them decide to have different policies about their schools. And as you can see, they sort of, you know, overcame a couple blips. This big tall one is what happened in January with Omicron.
We're only testing in one location, correct?
Yeah, the influence, just like that. We do have 2 portable samplers that if we did see something, we wanted to try to locate areas, we can go out and do it. And what's great about it is you get a 24-hour turnaround time. It gets shipped and we get sent the next day as a result.
Well, our point is, if we're only testing in one location now, we could have other areas in the town where we have problems. You're not gonna know that because it's all going to our treatment.
Right, well, that's, if we saw it, then we will be sampling at the plant too. We have a sampler, then we have 2 portables, we can go out and kind of isolate areas. And the sewer shed is what we can stop. We can drop a sampler in there and there, also test that or influence, and kind of see the correlation between where the results are coming from.
You haven't done that yet.
No.
Our friends in Madison County had 7 of these going for a similarly sized community, and they found it so useful they just ordered 7 more. So starting with one plant to see, you know, let's get a picture, a snapshot of the whole population. And if you've got, I think, 34,000 of your 43,000 people or something are served by this plant. Obviously, if you have a septic system, you're not involved, you know, represented.
So what type of adjustments, based on the reading, would a community make?
Different people have done different things, as I said, usually in combination with the case rate data that they're getting. And
Okay,
that's
but
what they get.
a case rate doesn't necessarily correlate to someone being sick or someone being hospitalized, which is what originally in the pandemic was being tracked. They were tracking, you know, how many people tested positive, and no, how many people were hospitalized and how many people had passed away with corona or because of corona, okay? But then I think it was at some point last year, all of a sudden, the hospitalization rate and the death rate started to go down, and then we started tracking positive cases, okay? And I'm just trying to understand what we would do with these results as a community.
Well, the best examples I can give are from the colleges and what they've done. So, for example, when they have very low testing rates, or they weren't regularly testing, they didn't have enough money to test all of the students at once. Actually, no, better example is from Madison County. The director there said this is a pretty small city, pretty small town. We don't have a lot of testing capacity. But when we see that wastewater number going up, we're going to get the state in to come and help us provide that testing capacity.
Yeah, because I know that there's quite a large number of colleges that mandated the vaccine and the booster for a demographic that has a 99.97% survivability rate. They're making them mandate getting an experimental vaccine, and I'm confused about that.
John, on this, I think the key point you want to take out of this is it's an earlier indication of what's going on. You can jump into this and you can ramp up masking and social distancing earlier, which lessens the severity of the spread. Because by the time the state or the communities are learning about it, it's already around. This way it catches the water earlier. It's really just early warning.
What's the cost of testing?
It's $250 every sample.
So what would it be over the 7 months, Rick, that we want to
Looking
test?
at, if we're doing it 2 times a week, additionally, it'd be about $15,000 over the 7 months.
Then if you do have to do the portable ones, is that still $250 also?
Well, again, like I said, that would give us the buffer, but also we would ramp up in the beginning, and then we can start backing off, and you would have that access to sample externally.
When does our current 7 months that is free right now end?
July or August. We just started in February.
Okay, well, that's good to know, so it's, I mean, we can do a little more time to figure out if we want to keep going into July. And I'm admitting, this intrigues me, especially because, well, he's not here to defend himself. I said Ray encountered our human resources director. He said to me last week, or whatever, that, you know, wait till you see what happens in Halloween 2022. You were saying things we might have another spike or something. Come on, really? Are we about to peter out of this thing, the Omicron and whatever? So if that 7 months, if we decide to pay for it, it would cross that path of July to January of 23, July, and we would hit that time frame in the Northeast that we've seen in 20 and 21 where it spiked, that November and December. Right?
Well, I think the ask was to start sooner so we can get a better baseline now, but
So we're on a free ride,
we're only doing once a week.
one sample through July.
Poor Rick showed up at his first meeting, and the group that has been doing sampling in Monroe County for 2 years said, it's great that you're here, it's wonderful that the state has brought you into their system. It's unfortunate that it's only one time a week because our experience has been that you need 2 or 3 times a week to be able to get a trend where you can make meaningful decisions in real time. So what Rick's asking is to be able to increase the frequency now so that you can learn and see the signal in real time. I should also annotate that the current governor has expressed very strong interest in this as a non-invasive way of tracking the pandemic in the future and signaled that continuing to support this in the future is likely priority. Of course, one never knows until the budget for the next year comes out. Right now, ARPA funds, towns are able to use CDC funding or at least health departments are able to use those funds for this kind of sampling if they wish. So I can't promise what's going to happen after 7 months, but the signals have all been that this is not going away.
I only have one last question, is you showed in here like the Alexandria, Virginia, and Eastern Franklin there. Are Pure Waters is on this right now? Is testing?
Monroe County?
Yeah.
That's Denmark.
They're testing, yes.
Right. And that Alexandria, Virginia, you showed how that's you got stormwater going in, and you got ours, we avoid I&I, is purely sanitary. Does that make it easier to sample?
Yeah. I just showed you that because Alexandria has a nicer graphic explaining that they have a combined sewer overflow and that combined sewers, and that nonetheless, the data coming from Van Leer is pretty good. Yours should be much better because you don't have that variability with the rainwater getting in all the time. They've been able to correct for that, but it's just you have a nice size system compared to Van Leer.
Very interesting, and we'll continue to talk about this because, you know, like I said, I'm intrigued from the standpoint of we're going to get beyond COVID. But if this is something, especially with what we're trying to do with our sewer plant, that could be of value to the community for the next 20 years of predicting certain things, that's the part I can't figure out. How do you use it? You know what I mean? But that's another day's discussion.
Well, I would be happy to have that conversation about what other communities have done some other times, because clearly
Sure.
this is something I love talking about for a long time, but you haven't only done it today. So
Katrina,
thank
thank
you so
you
much
very
for
much.
inviting
This
me and
is-
letting